don't think that wasn't one of the questions on our questionnaire. Were you a nuclear scientist or not? But I think that from the media and from the reports of people working in Iraq, we know that intellectuals, professors, other people are targeted. This is not unique. I mean, this goes back to Pol Pot and well beyond that. So I'm sure this is going on, but
it's supposed to be targeted by us, not by you.
Yeah, I don't know.
Please.
Are you going to go back and do another one, or are you going to do anything similar in a place similar?
Okay. Well, after the first one that we did, we thought, okay, I'm not sure we want to do this again, but we'd like to have somebody else do it again. And that was our position until John called me on the telephone, and we decided we'd do it again. But from a scientific standpoint, whenever you finish something, your immediate thoughts were, if I were to do this again, how would I do things differently? And so, of course, we've had those thoughts. I think it's not now time to do that, but there is a time. I think what we've shown is that recall bias is not the problem that we'd anticipated before, so that we can get good data. We have the information from the death certificates. I think we would do next time some careful scrutiny of the death certificates. Many places you will photocopy or photograph the death certificates and get some details out of that. There's a lot more things that we could do. I think next time for sampling, I would like to see how we would use Google Earth to do the sampling. I think that's an attractive mechanism that we all have available, and it could short-circuit some of the criticism that we have with sampling methods. So I think there's a lot of things that could be done, and from a scientific standpoint, I think it would be great.
Many people are under the impression that the Democrats have more compassion, they care about the suffering in Iraq. Has it been your experience? Have you had a chance to be invited to Congress to brief anybody?
Yes, actually, we have. We did a briefing in Congress, and it's interesting that the person that called me up first to ask me about this was a Republican congressman saying, and this was in shortly after the article came out, and he said, on both sides, we're concerned about things. He says the general feeling both among Republicans and Democrats is something has to change here, and we have to take a bigger control of things. So we wanted you to come and tell us, what did you find, and what does it mean? So I think there's been an interest. Yeah, we did. It was on C-SPAN. This was, I guess, early December.
You present these absolutely devastating figures in such a low-key way, just wonderful.
Yes. Well,
they are absolutely horrifying, absolutely horrifying. What is fascinating is that much of the world, of course, this extraordinary study today has been very well received and accepted. In much of Europe, it is taken for granted that these are probably the figures. Your courage, the courage of your team must have been absolutely extraordinary. And I really do commend your great intelligence, because we haven't seen these kinds of studies coming out at all. Now, how do you explain the immense difference between the kind of, even the sort of lower range of your figures and the claims, say, by the British government that it's around what they accept some 40,000, some figure like that? How do you explain this immense difference in assessment? And what do you think of the newspapers who have really tossed your extraordinary survey to the side and haven't really paid much attention?
Well, I think there's a lot we could talk about there. In doing public health, we spend a lot of time asking people. In fact, one of the basic principles is you go ask people, and they'll tell you what's happening. Obviously, we have to sample in a representative manner and so forth. So when we got criticism for this, the one criticism I think that amused the public health community more than anything else were the comments from John Howard in Australia, who said, I can't believe this Hopkins data. It's only based on house-to-house surveys. But basically in public health for a long time, we've known that there are two kinds of data. There's a data you get from what we call passive reporting. So if the doctor's office reports cases of sexually transmitted infections and so forth. That just goes up the system. And then there's another set of numbers that you get from active surveillance when you go actually and look. And those numbers are always much different from each other. So if you find out in the state of Massachusetts, how many cases of sexually transmitted infections were there in the last year, you get one number. If you go out and do a survey of the population, you get a number that's 2 or 3 times bigger than that. So this active and passive thing is very much a public health issue. And when we're looking at data in developing countries, it's easy to get data from hospitals and clinics, but that never tells you the whole story. And you cannot go from that number, especially in a dysfunctional or non-functional situation, to a national survey. You have to just use different methods. That's basically that. Now, as far as dispassionate and encourage and so forth, one of the things that when we start flailing ourselves in public health is the fact that we can produce numbers, but we're not very good at the advocacy side of things. You know, we can't really get the message across what this means. And so we need the help of other people to do that. We're not very good at that. I think maybe we're just selected to be not those kind of advocacy people. But that's one of our failings. We have to be more advocacy-oriented about some of these things.
Please.
You just answered that at the very end there about the advocacy piece, but I'm sort of interested in that. Indeed, it was presented in this sort of matter-of-fact way, but I mean, these numbers should be absolutely appalling, and I don't understand why we are not and everybody is not more appalled. And I know that you can't answer that, but from the briefing that you did in Congress, you know, are there people there who have a sense of the enormity of these numbers, and is it that it's being squelched and you're being criticized so much for the process, or are there people who are trying to make some sort of political message out of this?
I think that's an important question. My experience in meeting with a lot of staffers, a lot of people working in the Senate and Congress, there's already acceptance of the numbers. There's a realization of what the numbers mean and so forth. But above that level, of course, there's a political strata to things that deals with its interpretation. So I think that at many levels, when people think about things thoroughly, take time to understand the methods, and so there's appreciation of this. As far as making a good case, if you'd invited my colleague Les Roberts instead of me, he would have been very, very much more dramatic in this, and I've tried to be the science side of things, and he's tried to be the advocacy side. So we probably should do this as a team, actually.
So less is more, huh?
Less is more when it comes to that. Exactly.
I've heard Les Roberts talk about this in Washington, and it's amazing how everybody tries to frame it in terms of during Saddam's years, this number died, and now we're still. So there's that comparison, which is very strange.
Can't hear.
In Washington, there's this comparison. During Saddam's years, you know, X number were killed, and we're still below that number, so as if that's a good baseline to go with. But why do you think Iraq body count has been so vociferous in countering this? I mean, they're principally, on an advocacy issue, they were formed for the same reason. So why have they been so against your study?
Well, I think that that on one hand, they're defending their methods, which are using media surveillance, and there are other evidence from when media surveillance were used in Central America that it misses a large number of things. So we know that that's not a comprehensive method. Now, I've tried to be sympathetic toward body count because as difficult, well, as incomplete as facility-based data are, they're still important. And in public health, we have this approach that we sometimes use called sentinel surveillance. When you can't measure every place, pick out some key places, whether it's the media, whether it's the mortuaries, whether it's certain hospitals where you have good facilities, and follow what the trends are. And these are important to look at the trends. So I think that is important. Les believes that Iraq body count, which is dependent on donations and so forth, has been damaged by other methods of reporting, and that's the basis of things. But on the other hand, from a scientific standpoint, you can become very invested in what you're doing. You can be very defensive about it and not see sometimes what the shortages and difficulties, and some of you may have had that kind of experience. And I think if you've been doing this long enough, you know, it happens to all of us sometimes. There's just a big blank spot. We can't see various things.
I wonder what your thoughts are on the Iraq Living Conditions Survey, which is the only other epidemiologic survey to attempt to assess mortality. And if I recall, the figure was about 25,000 as of around early April of 2004.
Yes, that was a very competent group based in Scandinavia. Pedersen and his group that were doing that. And they've done excellent work. They've done good work in the Palestinian camps. They've done good work in Lebanon. They're a well-known and very competent group. They did a very large survey, many clusters. And the reason for that is they wanted to compare each government with the other governments. And you have to have a lot of clusters to do that. They had one question about mortality. And when they went back later on to double check on this, they found that in the case of children where they did a small return sample, they had missed about half the deaths. So it was not a study designed to look at deaths, and it was not a study powered to look at deaths. And
exception to that argument. He argues that, I'm not either an epidemiologist or a demographer, but he argues that there's special issues that it's known that child mortality is hard to estimate, and that there's no reason. I've asked him several times. He says there's no reason. They had no reason to believe that affected the adult violent mortality rate, which is why they didn't re-ask it.
Well, I think the other thing is when you do questionnaires, you have to focus on a specific issue. And the UNDP one was looking at development issues, and it was focused on that. And it wasn't primarily focused on mortality. And if you were to do that, I think you would have had to construct the questionnaire differently. But I think it's an interesting bit of data. I don't want to discount it. He's a competent person, and they had a very competent team to do it. It's just that I don't think it was asked in the depth and the breadth that could have produced the data that would be, I think, more representative.
Anyone else? Yes.
First of all, in response to your comment, I haven't read that study, but I think that in the press, often it's considered that all Shias are created equal, and that all Shias treat each other equal. And as you can probably attest, a lot of the violence in Boston in 2006 came from Shia on Shia violence, gangs fighting each other for control of certain areas of the city. And I think that it's really racist. Not saying that you are saying it, but the way that they're trying to sort of categorize all Iraqis as being Sunnis only support Sunni ideas, Shias only support Shia ideas. Iraq was very advanced, intellectual, academic society prior to the sanctions, But
in surveys, you need to care about.
Yeah, I know. I'd like to see
survey
surveys
people.
like you afterwards about what it is. I'd really like to read it. But I'm wondering about Ramadi. What your experience has been in Ramadi. Certainly, this summer it went through a large-scale action. It was very poorly reported in the press. If you had covered that at all during your
we had one. I believe we had one cluster there, but I don't have anything specific on that we didn't look at that in great detail. But I think following on your other point, now the criminal groups, criminality and so forth, is a self-financing, self-perpetuating thing, which I think is playing a bigger and bigger role. And teasing all of these things out from each other, I think is, well, in a survey like this, it's not possible to do.
Okay, I think we owe you a great round of applause.
Yeah. Okay.